Every day we lose about 100 hairs, and that is normal. Hair follows a growth cycle. Some strands are growing, others are shedding. However, when hair loss becomes excessive, it becomes noticeable, and I will share 7 proven ways to avoid it.
But how can we practically count hairs in everyday life? I doubt anyone's sitting there counting each strand every morning. So, how do we really tell if our hair loss is normal or if it has crossed into the excessive category?
Exactly. No one realistically counts every single strand, yet there is a practical method called the pull test. Take a small section of about 50 to 60 hairs, then gently pull from the scalp toward the tips. Normally, 1 to 3 hairs should come out. If more than 5 appear, that is not normal. The most frequent trigger of sudden, excessive shedding is telogen effluvium. It arises from stress, illness, or nutritional deficiency. Under ordinary conditions, roughly 10% of hairs rest in the telogen phase. During severe stress, up to 30% can shift into that stage. When the body senses threat, it prioritizes survival over appearance, shutting down non-essential processes.
Now, I'm curious. What's the number one reason people suddenly experience excessive shedding? And what's really happening inside our bodies when this occurs? But when we say stress, what specific life events are we usually talking about, and how quickly after these events does our hair actually start falling out?
Great point. When we discuss stress-induced hair loss, we are referring to major life events such as severe illness, surgery, pregnancy, emotional trauma, emigration, or any substantial psychological strain. Shedding typically begins 2 to 3 months after the stressor and may persist for about 6 months.
Okay, but now I'm wondering, do men and women lose hair the same way when stressed? Or is there a key difference in how it shows up?
Excellent question. Both men and women can experience stress-related shedding, yet it is much more frequent among women. In men, the predominant driver is genetic, powered by the hormone dihydrotestosterone acting on hair follicles over time. Stress can accelerate the process for men, but the loss is usually permanent and follows a clear pattern: receding hairline or crown thinning. In women, thinning is often diffuse, spreading across the entire scalp. Stress, iron deficiency, and hormonal fluctuations, such as those after pregnancy or during menopause, are common triggers. The good news is that female hair loss is frequently reversible with proper treatment.
If we could remember just one proven treatment to actually stop hair loss, what would it be, besides managing stress?
If I had to choose only one factor, iron is the key. Studies reveal that 30 to 50% of women with hair loss possess low ferritin, meaning depleted iron reserves. Ferritin readings below 30 nanograms per milliliter correlate strongly with heightened shedding. Iron fuels oxygen delivery to the hair follicle. Without it, growth slows and loss escalates. Picture trying to grow a plant in dry soil. No matter how ideal the conditions, without iron, the hair cannot thrive.
So, iron's like fuel for hair, but I keep hearing about minoxidil everywhere. Some say it's the most effective treatment for hair loss. So, how well does it actually work? In which cases? And what's the best way to use it?
Great question. Minoxidil is the most extensively studied and FDA-approved topical therapy for hair loss. It shows particular efficacy for androgenetic alopecia in both sexes. Nearly 60% of users observed denser hair within 3 to 6 months. Minoxidil boosts blood flow to follicles, prolongs the growth phase, and revives miniaturized hairs. The drawback is that After discontinuation, benefits vanish within about 6 months as follicles revert to their prior cycles.
Minoxidil sounds amazing, like waking up sleeping roots. But for those looking for something a bit more natural, I hear people swear by different oils. So, what are the top 3 natural oils that actually work best against hair loss, and how should we use them?
You are right. Certain essential oils possess scientific support. Rosemary oil ranks first. A small trial suggests it performs comparably to 2% minoxidil, enhancing growth and thickness after 6 months. It may dilate blood vessels, boost circulation to follicles, and provide antioxidant and anti-inflammatory effects. Mix 3 to 5 drops with a carrier oil such as coconut, apply to the scalp twice weekly, massage gently, and leave for at least 30 minutes or overnight. The second notable oil is peppermint oil. Animal data indicate increased follicle count and depth after 4 weeks, likely through menthol-driven vasodilation. Mix 3 to 5 drops with a tablespoon of carrier oil. Apply once or twice weekly. Leave for 20 to 30 minutes, then shampoo. The third option is pumpkin seed oil. Limited human research suggests an approximate 40% rise in hair count in men after 6 months. Pumpkin seed oil inhibits 5-alpha reductase, reducing dihydrotestosterone, which is particularly useful for male pattern loss. It can be taken orally at 400 milligrams daily or applied topically once weekly as a nourishing mask. To summarize, rosemary oil appears almost as effective as minoxidil, whereas peppermint oil is less potent. Many other natural oils, coconut, castor, argan, jojoba, and so forth, support hair health through moisturization, reduced breakage, improved shine, and scalp comfort. Yet they lack robust evidence or clear mechanisms for driving substantial regrowth.
Okay, so essential oils like rosemary and peppermint actually work like natural fertilizers. That's amazing. But I've also heard people using kitchen stuff like eggs or honey as hair masks. Are those just old-school myths, or is there real science behind them?
These classic home remedies are not complete myths, yet they are not miracle cures. They do not halt loss at the root the way minoxidil or rosemary might, but they nourish the shaft and lessen breakage, thereby boosting apparent volume and shine. For instance, a simple egg mask is relatively safe and effective. Eggs are rich in biotin and protein, helping repair damaged strands. Beat 1 egg with olive oil, apply to scalp and hair, leave for 30 minutes, then rinse with cool water. Avoid hot water, or the egg may cook in your hair. The second mask uses honey. As a natural humectant, honey locks in moisture and calms the scalp. Diluted honey reduced dandruff and itching within 4 weeks in small studies. Combine 2 tablespoons with warm water or yogurt, then apply weekly as a mask. Another choice is an aloe vera mask. Aloe contains enzymes that promote scalp health and may ease inflammation. Apply pure gel to the scalp, leave for 30 to 60 minutes, then rinse. Yes.
So we've got minoxidil, iron, rosemary oil, even egg masks. Love that we're mixing science and nature. But now I can't help but ask, is there anything we've missed? Maybe a powerful treatment that's even more effective than all these, but less talked about? O4 Mini.
Finasteride, often overlooked, is among the most effective options, particularly for male pattern loss. It blocks the enzyme 5-alpha reductase, which converts testosterone into dihydrotestosterone, the hormone that shrinks follicles in men. Clinical trials report that over 85% of men either halt loss or regrow hair after 6 to 12 months of daily use. It is more potent than minoxidil for preventing further loss. Other modalities include platelet-rich plasma therapy, where one's own blood is spun to concentrate growth factors before injection into the scalp, and low-level laser therapy using red light combs or helmets to stimulate follicles. These are employed less frequently than the natural approaches and finasteride.